So we'll go to our fourth and final scenario, which is to do with working within your area of competence. And very kindly, Layla Thompson has spoken to us about a time when she was in a difficult situation relating to that. Layla graduated from the University of Nottingham in July 2020. She recently completed a mixed small animal and equine internship and is now looking to pursue a career in small animal practice with a particular interest in soft tissue surgery. She's a full-time clinician and also is a chief mentor for Vet Mentor. So Chloe, can we play Layla's video, please?
My name's Layla Thompson and I'm a recent graduate for veterinary medicine from the University of Nottingham. I graduated in 2020. I then did a year-long mixed internship in equine and small animal practice, and now I'm a small animal vet in Surrey, and I'm also a chief mentor for veterinary with Medic Mentor. So I'm just going to talk to you a little bit about an experience that I found very difficult in my first year in practice, and that's surrounding equine anaesthesia. I started out, and within the first couple of weeks I got to do an equine surgery, so I got to do the anaesthesia with one of the more senior vets, and she kind of showed me the ropes, which was really great. But then there was a big gap between the next elective surgery that I was scheduled to do, so I think about 3 months went by, and then another surgery came in and my name was down to do it unassisted. And I said to my boss, I said, look, is it possible that I could have someone helping me with this? I've only had one sort of practice run, shall we say, and that was a really long time ago. And so I said, I feel a bit uncomfortable doing it solo. Can I have someone in helping me? And my boss said, no, there's no one available that day to help you, so you'll have to do it on your own. And I kind of continued to say that I'm really not that comfortable doing it unassisted. And she said, well, if you don't want to do it, then we'll find somebody else, but you can't do it with someone. So I really labored over it, but I said to her, look, I don't feel confident, so I didn't do it. I declined to do it, and they swapped me out with one of the other interns, and I was a bit upset about it because, as I said before, I do really like anaesthesia, but I thought, oh well, there's always the next one. But then what kind of proceeded to happen was I got a bit excluded from the anaesthetics for some reason or another. I don't know if I upset the equine surgeon by refusing to do it, but I found myself being left out. It was always being scheduled for the other intern and not for me. And I got really down about it because I really wanted to do it, but I still didn't feel ready to do it on my own. And I'd done a lot of reading up in my own time. I'd had some seminars from one of the other vets in the practice, but I think I just felt that if something goes wrong and I've not had I'm not done it enough, I who knows what could have happened, and I just didn't want to put the patient at risk. Yeah, then going forwards I got excluded, which was difficult to deal with, and I did try and raise it. I think being a new grad in a new place, it's always quite scary raising concerns, but I had regular kind of reviews, and they would ask me what I would like to do more of or what I would like more experience in, and every time I said I really wanted more experience with equine anaesthesia, and it just got really swept under the rug and really kind of ignored. But I guess what I've learned is that if you're having trouble with a colleague, even if it's a very senior colleague, escalating that further is really important. So, if I were put in the same situation again, I think that I would take it one step further. I'd speak to kind of someone from the HR department, or someone else also in a senior position, and just say, just vocalize my concerns a little bit and see if actually there was something that could be done about it. It can be really challenging, and I think in your first couple of months you'll be put in positions where you feel out of your depth, and I think it's really important to try and recognize that and don't let people pressure you into doing things that you don't feel comfortable doing. So I think looking back, I did make the right decision. I think at the time I really felt like I'd made the wrong decision. I think immediately after I just kind of felt like, oh, I really should have just said yes to doing that. I'm sure it would have been fine. And then, I would have got to do one, and I wouldn't have been excluded. And now looking back on a more longer term reflection, I think I definitely made the right decision. You definitely shouldn't feel pressured into doing something that you don't want to do or you don't feel comfortable doing, obviously, you know, within reason. But something like monitoring anaesthetic, which is very risky, especially in horses, you know, I definitely made the right decision saying no, I feel like I need a little bit more training. So yeah, if I were put into the same position again, ultimately the outcome would be the same. I would still say no, but maybe how I dealt with that going forwards would be slightly different.
Okay, so two themes there. Layla's competence, feeling like she's not competent to carry out the procedure, but also having difficulties with her colleague. Let me just bring my slides back up. Did any of you have any thoughts on this one? Obviously, it's always difficult, firstly, to put your head above the parapet and say, actually, I'm not comfortable with this. And secondly, it's really difficult to have discussions when you're having difficulties with a colleague, and that colleague in particular is more senior to you. So did anyone have any thoughts, or has anyone been in a similar situation to this that they might like to share? Emma, I don't know if anything is coming through on Slido on this one.
We haven't had anything yet, Gemma.
So I wonder if this were to happen. I know that Vet GDP has just come in, and that veterinary surgeons that are now graduating will have a vet GDP advisor, and I wonder if this would be something that they could support new graduates with if they were in this kind of situation. So I'm thinking, for those of you that are students, if you find yourself in a situation where you're having difficulties in terms of getting the experience you need, and also with maybe a colleague or a more senior colleague, you could speak to your vet GDP advisor. Just having a look.
We've had some come in on some comments on Slido.
Yeah.
I'd really struggle when there is a problem with the senior. How do I start this conversation? How long do I leave it?
Yeah, I think that's going to be a matter of judgment in every case, and it's never easy. I think if you have a colleague in the practice that you trust, or another senior colleague that you could speak to, then that can be a useful way to kind of gauge whether it's time to raise it or to try and work through it. So I think that will be a matter of judgment in every case, and it's not easy, and it's exactly why we wanted to talk about it this evening, because it really is a very difficult situation to deal with. In terms of Layla's comment about whether she did the right thing and she was second guessing herself and thinking, oh God, maybe I should have just done it, and then this wouldn't have happened. She absolutely did the right thing if she wasn't feeling competent. As you can see on the slide I'm showing now, paragraph 1.2 of the Code of Conduct says that you must keep within your own area of competence and refer cases responsibly. So if you don't feel comfortable, it's absolutely right to say, actually, I'm not, can I watch somebody else do it, or can somebody be with me, or whatever it is. That's absolutely appropriate. And the other thing to bear in mind is that at 4.2 we say veterinary surgeons must ensure that tasks are delegated only to people who have the appropriate competence. So there is also an obligation on more senior veterinary surgeons, when they're delegating to new graduates, new colleagues, that they bear in mind that they are delegating to people who feel competent and are confident to do these procedures. So it's a two-way street in terms of that delegation. Just having a look at chapter 2 of the supporting guidance as well, that just reiterates the fact that in order to provide good veterinary care, veterinary surgeons should keep within their own areas of competence. So it's really reiterated in the code and in the supporting guidance. So Layla did absolutely the right thing by putting her hand up and saying, I don't feel comfortable, even though it clearly was very difficult for her. Is there any more on this one, Emma?
Someone was saying, I've had to do routine surgery without support a few weeks after entering practice that I wasn't too comfortable. I wish I had spoken up to.
Yeah. Well, I think people will really benefit from hearing from that. So thank you for sharing, whoever that was. It's part of that professional responsibility to kind of put your hand up and say when you don't feel comfortable. But I mean, we absolutely appreciate that it is very difficult, because you want to impress, make a good impression, and want people to think that they can rely on you. So it is very difficult, but so thank you for sharing that. If there's nothing else, Emma, I'll move on to telling everyone how they can get in touch with the advice team.
Yep.
Yeah. So as I said at the beginning and at several points, there is the RCVS advice team that you can call for advice if you are in a if you do find yourself in a difficult situation. The email address, the phone number are there, and all calls are treated confidentially. You don't even need to tell us your name if you don't want to. You can just tell us, I've got this situation, do you have any advice for me? So things like ethical dilemmas, or where you're not sure what the code of conduct or the guidance says about a particular situation you're facing, you can call us or send an email, and we'll give you the best advice we can on how to deal with that.